In our particular region, in the southeast region, there is a high incidence of lung cancer, or specifically thoracic cancer, primarily lung, some esophageal cancer, but what we're primarily concerned with is the prevalence of lung cancer. It's typically something that's diagnosed, and unfortunately frequently diagnosed, because it manifests itself because the patient becomes symptomatic, coughing up blood, sometimes chest pain, sometimes pains elsewhere in the body, and then also when it has spread to other parts of the body, the manifestations related to that. Patients who are initially found to have a lung mass may not be a lung cancer, but they will undergo a CT scan. Sometimes we find the lung cancer in the process of doing a CT scan for other reasons. The CT scan, a CT scan, is just that. It's a computerized axial tomography, fancy name for taking pictures across the chest and better defining the tissues within the chest. So we use that frequently for diagnosing many things, certainly including lung cancer. We can use it for staging lung cancer. When we do a PET CT scan, it's a machine that really combines what's called a PET imager, which is a machine that uses radioisotopes to image tissues. And it marries that, or combines that, or what we call fuses that, with a CT scan. So it's really both procedures in one. The two types of images are then overlain, or what we call fused, so that we can better define where abnormal tissues may be. The PET scanner adds to the CT scanner in that the PET scanner is more of what we call a functional imager. That is, it looks at the metabolism of tissue. Tumors, lung cancers for example, utilize more glucose than normal tissue. And therefore, when we administer some radioactive glucose, a specific form, to the patient, the PET scanner lets us see where there is more metabolic activity or more glucose metabolism. And then the CT scan part of it helps us to define exactly where that potentially abnormal tissue may be. And this is used for, again, diagnosis and initial staging, or determination of the extent of disease is another term for staging. As well as during the subsequent treatment of that patient to help monitor the course of treatment and effectiveness of treatment. And then following treatment, it's also utilized to follow patients to monitor them for any evidence of recurrence. What we would like to do is diagnose them very early before they become symptomatic, because that makes treatment simpler and shorter and hopefully more effective for the patient.